This is for ABG, so a physician has ordered arterial blood gases. You would go to the patient's chart and check to see if the patient is on any blood thinners. Make sure the order's there. Check for any medications that might require you to hold pressure longer after the needle stick, any blood thinners. If there are any bleeding disorders present, then you would head to the patient's room. Hello, Mr. Blank. My name is Trisha. I'm with Respiratory Care. So the doctor would like me to get some arterial blood gases today. You've gotten blood draws, and that comes from a vein. This one comes from your arteries, and it's a little bit lower in the arm. So we're going to go ahead and do that today. This will just tell us how your breathing is affecting you right now. Can I get your name and date of birth? Okay, so I'm going to wash my hands. I'm going to put some gloves on, gather all my necessary supplies. And Mr. Blank, I'm going to do a little test on your arm to make sure you've got enough circulation coming through that arm that we can perform this test on the arm here. So, all right, so I'm going to first, this arm here, I'm going to palpate just to make sure that the artery is, I can feel that artery pumping through there, and I do feel that. So then I'm just going to remove this. Patient's arm wouldn't have been on a towel yet. So I'm going to have you just relax your arm, and I'm going to place pressure on two arteries, your radial artery and your ulnar artery. I'm going to have you make a fist with your hands twice. Go ahead and release it. And again, and release it, and see how your hand is blanched on the inside there. It looks a little white compared to the rest of your skin. So I'm going to release the ulnar artery and see how your color is returning very quickly. So this means we have enough circulation, we can perform the test in this arm. So I'm going to place a towel. This kind of helps stabilize your arm, and if you would just bend it down just a little bit for me, it's going to help, like I said, stabilize that artery so it doesn't move on me. So I'm first going to cleanse the area here. We have just rubbing alcohol. Go ahead and cleanse for about 30 seconds in a circular motion, and then I will cleanse them with the tips of my fingers as well. All right, so here we have our needle, and I would pull back at least a half a cc, if not a little bit more. The blood will fill into this syringe. So, all right, so I'm going to go ahead and poke you, Mr. Blank. So I feel that artery. We're going to enter the needle at a 45-degree angle, bevel up right into that artery. If you're not getting anything, you can pull back a little bit until you see that blood return. The blood will fill itself in the syringe as we're nearing the amount that we need. We're going to hold pressure and remove that needle, and then we're going to put that needle into the cork. So that's safely in the cork. We're going to hold pressure for at least 5 minutes. If the patient is on a blood thinner or they do have any bleeding disorders, we're going to hold that for about 10 minutes. So we're going to hold that pressure. We're going to check the site, and it looks good. No hematoma. We're going to put the Band-Aid on. So we've got the Band-Aid on. Then we are going to fill out our patient information. We're going to include oxygenation status, what time the sample was taken, along with the other pertinent patient information for lab. Then we are going to remove that needle, place our syringe into this little device to remove the bubbles. And then we're going to place the syringe into a bag and get this to lab as quickly as possible for analysis.